I wanted to share with you some different options if you're possibly going to be losing a tooth or teeth. You have different ways to replace those missing teeth. One would be a removable partial that has kind of the hooks and all the business in it that comes in and out of your mouth. That's called removable. And then we have the kind of better, more natural options, the fixed bridge, natural bridge, or the single or multiple implants. We'll talk about the pros and cons of each because there are reasons to do both and it just depends. So I'm going to share with you from my vantage point why I like, if you're losing one or two teeth, why to have implant versus a bridge. A conventional bridge is fused together. This is what we call a three-tooth bridge. So if you were losing this tooth right in the middle, one of the ways in order to be able to fill that gap would be to put caps or crowns on the adjacent teeth. This is a tooth that's been prepared for a crown. That's what we have to do in order to have this fit over the teeth. It functions very well. So you'll be able to eat and function very well. The downside is you can't floss in between the teeth. So you have to use a special threader to get up underneath here. And I always like to think about long term. If you're 35 years old, wonderful. Your dexterity is great. As you get older, in your 60s, 70s, 80s, imagine having to thread it's almost like threading the needle if you're a sewer. You have to thread underneath here to keep it clean. Otherwise, what we typically see is patients get cavities on either of the adjacent teeth because it's hard and so they don't do it. They do their best, but that's just the inevitable wear of the conventional bridge. With a single tooth implant, which you can see right here, it doesn't alter the adjacent teeth. So we leave these teeth alone, which is a good thing, and then we just address the main problem, which is the bad tooth. As you can see, we place an implant in here, which is a titanium tooth root. By having the implant, it preserves the bone because there's going to be something here. If we take the tooth out, the bone will shrink and collapse. And so sometimes over time there can be a big space, even if you have a bridge. And certainly there will be if you have a partial because the partial is resting on that. That will be integrated into the bone. The gum tissue grows around it. Eventually it looks kind of like that. If you were looking at it in your own mouth, you wouldn't be able to tell it from another tooth. And oftentimes the dentist can't tell if it's an implant or not. A lot of our patients ask, Dr. Crawford, if you take that tooth out, am I going to have to wait 3 or 4 months with a hole in my mouth? The answer is no. We will provide an appliance for you that will go in immediately. So that very same day, you'll have some type of removable appliance that will replace that tooth during the whole healing until you're ready to get the final crown that would go on the tooth. So again, just to kind of recap, what are the advantages of the implant? You're able to floss and clean between the other teeth. It preserves the bone where the tooth came out. It saves the other teeth. It functions very much like your own natural teeth. The advantages of a bridge: it stays in your mouth. It doesn't come out. It functions very much like your own natural teeth. The disadvantages: you're very susceptible to getting cavities. It's much more difficult to keep the area clean. I hope that's been helpful to you on the pros and cons of conventional fixed bridge work versus a single implant.